remember that paramedic as if he were one of my best friends. I think it's one of the best jobs in the world. Emergency medicine has always been my first love. I have many friends and colleagues who are BMCC Paramedics, and I have always admired the courage and the dedication that they bring. You might handle millions of dollars every day as a finance guy, but you don't have the opportunity to be somebody that has saved the life of a person who will remember you forever. The medical director is the person who's ultimately responsible that the medical training that we're offering meets accepted standards of care. And so during the entire program, I help with the rest of the faculty making decisions on what topics we should address according to New York State guidelines and national guidelines, whether our instructors are teaching appropriately, whether our practical training will adequately enable students once they graduate to perform well. And I also, in the very end, sign off on the students saying that they meet accepted standards of education and care, that when they leave us and graduate from us, I can be assured that they will provide good paramedic care. So I have to say at the end, once they pass all their tests, both practically and written, that yes, you're okay as a paramedic. So I've been an emergency physician for almost 50 years now. Emergency medicine has always been my first love. And from the very beginning of paramedicine in New York, my first entry in it was to give continuing medical education to the first paramedics that had ever graduated in New York City. And they would come to their base station, and I was the medical director of one of the hospital base stations, to have educational sessions on a regular basis every 2 weeks or so. And I became very impressed with their level of professionalism. Very early in the course of paramedicine, we had these people out in the streets that could do life-saving treatment that before we could never do, such as defibrillate people and provide airway support. And so I realized that this was a really important addition to emergency care in New York, and I was very happy to be one of the medical directors. Hence, I was then interested in becoming somebody who would teach the paramedicine that I saw these young men and women performing in the street. And being on the other end of receiving them, meaning that I was the doctor who they would come and present the patients to, I saw how important it was that we had a good relationship and that they knew what they were doing and that they transmitted the appropriate care and information when they dropped off the patient to us. So I've been teaching it also for almost 50 years. The curriculum is pretty standardized because of what New York State requires in terms of topics that have to be covered and how many practical hours in hospital on the ambulance they have. And so my role is basically to agree with the textbooks that we use, agree with the testing modalities we use, agree and approve the way that we evaluate students, agree and approve the preceptors that we have out in the field, and agree and approve who the paramedic instructors are that are giving them practical instruction in the program. So this program, number one, has incredible resources. The college campus itself is spectacular. I mean, many paramedic programs are, in a conference room somewhere in a voluntary ambulance service or a conference room in a hospital. This has all the resources of the college, including a terrific location in Lower Manhattan, terrific conference rooms. They have wonderful equipment with lots of mannequins, and they have a very supportive faculty and a very supportive administration. Not only that, it's one of the oldest paramedic training programs in New York City, so it's had long experience in what works and what doesn't work. A combination of the facilities, the long history, the support of the faculty and the administration, And another thing I have to say that makes it stand out is Megan is just such a fabulous person. She is one of the most remarkable course administrators I have ever worked with. Constantly has terrific ideas. So Megan herself is something that really has taken this program from pretty excellent to absolutely spectacular. I think the relationship with administration has improved. Certainly, every planner who's the department chair has lobbied for us continuously to have the best equipment and all the support we need. The students have the sim center where they can have access to mannequins, special training, so that they can practice on mannequins before they actually have real life practice. I've seen it evolve. Things have gotten quite a bit better in terms of facilities and also the number of extra things we offer, the ALS and PALS training, the psychological support, all of those things have evolved over the years also. I would say that they have only my greatest admiration. I have many friends and colleagues who are EMTs and paramedics, and I have always admired the courage and the dedication that they bring to their job, because when they get these calls, they never know what's going to be on the other side of the door of the house or apartment they enter. They never know what they're going to find on the street when they have a call. And they always have to be ready. And sometimes the situations are difficult. They are dirty. They are dangerous. And still they do that with courage and conviction. The other thing I would tell them is that I think it's one of the best jobs in the world. You could complete this 2-year program and get an associate's degree with not a whole lot of experience beforehand and basically just a college education. And you finish it having one of the most satisfying jobs that I think you could have. There are people in finance, there are people in advertising, there are people in sales, there are people in computer work that I think sometimes wish they could have the opportunity that these paramedics and EMTs have every day, which is the opportunity to save someone's life and the opportunity to do something that's going to really make a difference in someone's life. And so you might handle millions of dollars every day as a finance guy, but you don't have the opportunity to be somebody that has saved the life of a person who will remember you forever. I know a paramedic who took care of me once when I had a bad injury. And to this day, I remember that paramedic as if he were one of my best friends, because at the time I was injured, the care he gave me was so important at the time that I'll never forget that guy. So that opportunity to live in someone's memory forever is the kind of posterity that the average person doesn't get. It's easy to take care of a patient in a controlled hospital environment where you have 3 or 4 nurses and a couple residents and an anesthesiologist. But when you're out there, just you and your partner, man, it's a whole different story. So one of the main challenges, I think, is having ongoing clinical exposure for these students, because hospitals more and more, because of worries about lawsuits and medical malpractice and their own needs for training their own house staff and medical students and nursing students, it's harder and harder to provide our students with the in-hospital experience or the ambulance experience where they actually get to give direct patient care. So one of the challenges is continuing to be able to have ambulance services and hospitals let our students in to get that clinical support. The second thing that's a challenge for us, of course, is the challenges to any educational institution. CUNY, Borough Manhattan Community College, has multiple programs, and to ensure that they continue to want to support this paramedic program means that we have to keep showing that we have students that are interested in enrolling in it and that we are successful in graduating students. And we've had difficulty in the last 3 or 4 years recruiting enough students to the program, I think because as a result of the pandemic. It was devastating for many people out of the field and many people on the front lines in hospital medicine, like emergency room doctors and nurses. the pandemic really was a kind of horrific experience for people because it was quite challenging psychologically and personally and medically. I mean, many of the caregivers on the front lines got sick themselves and were afraid they'd make their family sick. So there was less interest in providing this direct patient care, but I think the interest is coming back up again. And so one of our challenges is to continue to recruit capable, interested, dedicated students who we know are going to fulfill the program. So one thing, as I said, is there's been a drop in recruitment. So that's a major change, which I think is bouncing back. Another thing I think is it made us all more aware of how vulnerable we were and how important it is to have appropriate personal protection and making sure that we don't get illnesses from patients or transmit them. So we're much more careful about wearing masks and wearing gloves and wearing gowns. Remember that they do not have to be perfect and they don't have to have all the answers. They just have remain calm and cool and think back to their training and remember their protocols and just say, I'm going to do the best I can. And they will. So one of the things, of course, that keeps me up to date is just the ongoing teaching because we have our advisory group, and on that advisory group are healthcare providers. There are people who administrate EMS program, people who have seats on New York City and New York State emergency medicine boards that fill me in on new regulations, that fill me in on new procedures, that fill me in on new requirements for education. I, of course, also read several medical journals. I still am very active working full time as a physician, so that also keeps me up to date on what's going on. I think it's great for allaying the anxieties of people that have simple medical problems. And I think it's also great for giving people an entry point into the medical system if they have difficulty in connecting with their private doctors. And so telemedicine gives a credentialed person, either a nurse practitioner or a PA or a doctor, to talk to. And they can either be reassured that their problem is self-limited and not terrible or needs further care. And often that advice that you need further evaluation can expedite them into getting into the hospital, the emergency room, or to their own doctor. So I think it's a great entry point. But it's not the be all and end all of medicine because in many circumstances, you really actually have to be physically in front of the patient. You know, by telemedicine, you can't get a terrific look at somebody's throat. You can't hear their lungs. You can't get their vital signs. So it's really good as an entry point. It's really good for small problems, but it's not the be all and end all of medicine. I think one of the most important qualities is that they must obviously want to provide help. The second important quality, I think, is to be able to distance themselves somewhat from people who are often very agitated or angry or inebriated or irrational, and to be able to see that person as a human being without letting their own emotions and anger react that way. So it's being able to see the patient as a human being who has needs, and no matter what the behavior of that other person is, they should be able to get cut through whatever that person's maladaptive presentation is to provide the care. And then the other thing, of course, is that they themselves have to keep up with medicine. One of the things that is my own personal thing that I have to keep reminding myself is what exactly I said that paramedics and EMTs have to do. No matter how offensive or upset or angry patients are, I have to divorce that behavior from whatever their needs are and be able to relate to them, even if I find their behavior offensive or even if I think that they don't really need me or whatever. I still have to recognize that I could be in that situation sometimes too, and how would I want somebody to treat me? I think think that there are certificate programs that are not degree granting that are acceptable, but I think that one of the most important things about a college degree is, and certainly the degree that we give here, is first of all, as these students get in their first year, a little bit broader education than they're going to come out of high school with. That enables them to have better math and reading skills. Secondly, I think that a college program like this provides a better clinical and practical experience. But most importantly, I think it provides a stepping stone for job advancement. And so once they have this degree, it can provide them the background so that they can go even further and further and advance themselves. Because many of the people who start this program are young, people young in their 20s, and they have 40 years maybe of employment ahead of them. So this credential provides them first start to get other credentials that can take them up the ladder of medical care. I have been not just a medical director here at BMCC, but I have also been the director of several emergency rooms in New York City. I started a residency program in emergency medicine and have worked at academic teaching hospitals almost my whole life. So what has been most rewarding for me is the many, many, many people that I have encountered as residents and as paramedic and nursing and medical students that I've been able to impart my own feelings about medicine too. So the ability to teach and provide some sort of posterity, your own knowledge to give to other people has been the most meaningful. I'll tell you the thing I've been most impressed with my students is many of them have come from situations that have been extremely challenging, either because of their own backgrounds in terms of nationality and ethnicity, economics and family support, but their own life circumstances, where many of them have to work while they get their education. And it's just been so impressive to me how dedicated and how hard they work, because I know it's a tough job to finish this program or finish medical school or finish a residency. And the people that do it, by the time they finish, you know that number one is something they really wanted, and number two, that they have the wherewithal to be really good at what they do. Oh, I just hope the same legacy that I have wish on my students, that there'll be a few people out there who remember me being kind and healing at their moment of need when I treated them.